was diagnosed with follicular lymphoma when I was 14, so it was like 2 weeks into my freshman year of high school.
He explained that I had Hodgkin's lymphoma, stage 3, and the treatments that we were going to go through.
Right before I was diagnosed, I had my son, Alexander. I was 20 years old at the time.
He said that they were pretty sure that I had leukemia. And I just laid there for a minute just thinking, leukemia? How is that possible? Little kids get that, little babies get that.
When I found out that Kyle was diagnosed, I was a sophomore in high school. I was very focused on my friends. Definitely did not have my priorities set at that time yet.
In 2005, when I was diagnosed with stage 3 Hodgkin's disease here at Gundersen Lutheran, I was in the middle of spring football, working out, doing those things when I found a lump underneath my right arm.
When that happened, I was kind of playing sports, like soccer, basketball.
The idea for what we're trying to do with this group came up a couple years ago when I was finishing up cancer treatment. I talked about with some other people that were going through it, that were about my age, along with the doctors and nurses, about what was out there for kind of a social networking group for people our age to kind of lean on, to ask questions, to use when things came up that they were struggling with.
I knew nothing about what the treatments were. Like, I didn't know what chemotherapy was or what radiation treatment was. I just kind of knew what it did to the body.
The only people that I knew that had ever been through chemotherapy were 60, 70, 80 years old, people who had been smoking their whole lives and had lung cancer, and I hadn't done any of those things. I didn't have a single risk factor in my life for getting cancer.
I really didn't know anything about cancer before I was diagnosed. It was a scary thought. I knew that a lot of people died from it. I hope it goes big. I think it'd be the coolest thing I wish it would have been there when I was diagnosed, when I was going through treatment.
I think it's a great thing. It's just a support group that we can pool our experiences together with, and that we can use to help them feel better informed, to help them feel like they're not completely alone, that there are people their age or older who did go through this and we're about the same age.
I think that having somebody to talk to and just cry to or just complain to would be great for other cancer siblings, just because you are kind of thrown on the back burner at times and it's not good to hold it all in.
There's things that you can talk with your friends about, and they're going to be a huge asset for you, but there's things that you don't want to talk to your friends about when it comes to this, that you just aren't comfortable bringing up in front of them. Things about, well, what ifs, stuff like that, things that we've all considered as people who've been diagnosed with cancer. What if this doesn't work? Those kind of things might not be comfortable to talk about with your friends, but they're things that all of us who have survived cancer have considered, and maybe that perspective is just something that you need.
We also got inspirational tapes where we did mental imagery, and I think that helped a lot. It was like imagining that the white blood cells in your body are warriors or fighters, and here they are with the chemotherapy helping to fight back the cancer. We did a lot of imagery stuff, and I think that really helped.
The best thing you can do for yourself is to have a hobby, something that can take your mind off of being sick, whether it's exercise or reading historic novels, whatever. Just being able to keep your mind off of it for at least a couple hours a day really helps.
Don't be afraid to ask a lot of questions. It's your body. Your body is telling you that something's wrong, and everyone around you just wants you to get better and do so as quickly as possible. A couple things that were the most helpful for me when going through the treatment was the support that I found through the doctors, nurses, all the faces that you see that are trying to treat you, because there are a lot of faces. And then also My friends and family, of course, were always there. A lot of them didn't understand what chemotherapy was, what a normal day of treatment would be for me.
It is hard to sometimes go to the hospital because you're seeing that person that is getting all of that attention, and sometimes you want some of that for yourself, and it's okay to feel that way, and you're not being self-centered by feeling like that, because it's a hard time for you too.
It looks scary and it's intimidating, but there are days that you aren't going to be sick. There are days that you're gonna be okay, and you're gonna go and have fun with your friends and your family, and you know, it's always there, but it doesn't have to be the center of your life. You know, have things that are important around you to not be focused on I'm sick. Like, don't think about that, and that helps a ton, just to be a normal kid that's just sick sometimes.
Try to get to know someone that has dealt with it, and then ask them a lot of questions about it. Don't be afraid of it, and don't ever give up with it.
Our purpose for this group is to help you get through an experience as quickly as possible in the healthiest way as possible, because we've been there. We know what you've been through. We're experiencing the same things with other people in our lives today, and if we can be just a little help while you go through something like this, that's what we want to be.